Welcome to our Medical Legal Topic of the Month, where I discuss medical topics that may impact your clients. My name is Dr. Anthony Inglaze. I'm a chiropractic neurologist and also the clinical director for the Brooks Clinic. The topic we are going to discuss today is spondylolysis. Definition of spondylolysis, also known as a pars defect, is a defect or stress fracture in one of the vertebrae, typically in the lower back region, also known as the lumbar spine. This defect can weaken the bone and may lead to instability. These medical terms can be very confusing, so here's the way to know the difference between the three. Spondylolysis is a defect or fracture in the spine. Spondylosis is degenerative findings in the spine. And spondylolisthesis is slippage of one vertebrae on another. Causes of spondylolysis. It often occurs due to repetitive stress in the spine, such as excessive bending backward, hyperextension, or repetitive twisting motions. It can also be traumatic in nature, from most often a hyperextension or twisting related injury. Athletes who participate in sports like gymnastics, football, or weightlifting may be at higher risk due to repetitive strain these activities place on the spine. Diagnosis of spondylolysis, usually diagnosed through a combination of both comprehensive history, physical exam, imaging tests such as X-rays, CT scans, and MRI. Symptoms of spondylolysis. Some individuals with spondylolysis may not experience any symptoms at all. Others may experience low back pain that worsens with activity and improves with rest. And in severe cases, the condition can lead to spinal instability, which may cause nerve compression and result in symptoms such as leg pain, numbness, or weakness. There's a variety of treatment options for spondylolysis, ranging from conservative treatments to pain management with medication injections to more severe cases that may require surgery. Impact on the patient. Spondylolysis can have a significant impact on the affected individual's quality of life, especially if it leads to chronic pain or spinal instability. It may limit participation in certain activities or sports, and it may limit certain work activities and can affect the overall mobility and function of the patient. So here we go with a lumbar side view x-ray. This is a normal x-ray. If we go to the caricature down here, this is the pars region of the lumbar spine. This is where we get these fractures or defects of the bone called a spondylolysis. This is an x-ray view, side view of the lumbar spine. As you can see here, here is the defect. You can see that line or that lucent or dark line through the bone. You can see here that bone is solid. There is no defect through here. However, if you look here, you see the defect. And this is called an oblique view of the lumbar spine. It's more easily to see. This is a normal intact pars, and here is the defect on that bone. This image here shows a normal pars on the back of the lumbar spine. This shows a spondylolysis, or the fracture or defect of that bone. And subsequently, when that bone fractures or there's a defect in it, it can cause an instability, causing the bone that it originates from to shift forward on the bone below. That is called a spondylolisthesis. You may ask, how do we know when there is a defect in this bone, or the fracture, also known as the spondylolysis? How do we know if this area is stable or not? Well, we take a side view x-ray of the lower back, and then we have the patient bend all the way forward and all the way backwards. These bones should stay in alignment with each other through these movements, and you can see at this level they do not. They shift. And depending on how much they shift indicates on how unstable that region is. So spondylolysis, which is fracture or defect in the bone of the lower back, with spondylolisthesis, which is slippage of one bone on the other due to the fracture or defect, can cause significant neurological issues, including bowel bladder dysfunction, numbness, tingling, weakness, or radiating pain into the lower extremity. Here's the side view of the lower back. Here's where the fracture is. This is what it should look like. This is, in this case, what it looks like with the defect, causing this bone to be unstable above, shifting forward on the bone below. This is where your spinal canal is. Here is a caricature picture of the spinal canal with the bones removed in the back, these bones removed, so you can see all the spinal nerve roots that go down through there. As you can see, these nerve roots would come through here and have to traverse all the way backwards to go down into the legs. This can cause compression, it can cause shearing, it can cause tension on these lumbar nerve roots, causing neurological symptoms into the lower extremity. Spondylolysis is important for you to know about and the reasons why. If the spondylolysis is directly related to a recent injury, such as a motor vehicle crash or a fall, depending on the severity, or if the spondylolysis was pre-existing, however made worse or aggravated by the recent injury, then it can lead to significant medical expenses, including diagnostic tests, treatment, rehabilitation, and possible surgery. It can also cause pain and suffering and loss of income due to time off work and diminished quality of life. Thank you for taking the time to review our topic of the month with me, spondylolysis. If you have any questions or confusion regarding the topic, please reach out to me at the clinic at 405-943-0303. You can also reach me by email at ainglaze@thebrooksclinic.com. Thank you and see you next month.